Okay, so we're looking at cranial nerve 12, which is the hypoglossal.
Oh.
Okay, now what this nerve does is it's about the tongue. Okay, so the first thing that you can do, which is actually kind of easy, is you can have the person with the tongue in their mouth ask them to push to the side. And what you're gonna do is you push, and what I'm gonna do is push back. Now his tongue's pretty strong, okay? And same with the other side, okay? I'm gonna push, okay? And if you're looking at this point in time, you know, to see if the tongue deviates. So if this happens and I have them do that and it caves on that side, suppose they're an individual who's had a stroke and it caves, I'll tell you the next thing. I have gloves on. The next thing I'm gonna ask Joseph to do is I'm gonna ask him to stick his tongue out.
And before we do that, just to make a note, for all of these, I've been turning my head this way so you can see what he's doing, but obviously you would have them in midline when you're actually testing it, because different postural techniques that you have with your head turns can affect things. So you would want to make sure that their head's right in midline. Again, the only reason that we're doing that when I'm turning is to show you so you can have a better view, but normally keeping it midline.
Yeah, and so again, if he did this, he should be able to feel moderate force. I should be able to push against it. And if he can't, and if it's weak and I see it caving, I'm gonna go back to one of those earlier tests where I ask him to stick his tongue out and hold the tongue out for me. And what I'm gonna do is I'm gonna take this and I'm gonna push to one side, and I want him to fight. And so if the one side,
The guy's clean.
yeah, you wet all over my hand. But if the one side, okay, is weak, okay, you're just going to be able to crush and move right through it, versus opposite side, which might hold, and that might be the side that is normal, okay, and the other side might be the side that has the stroke. But you'll see it and you'll feel it immediately.
I thought you were testing the other side.
No, I ain't touching the other side. You're like, that was, yuck. All right, but anyway, so that's the logic between the hypoglossal. So easiest test is here, that you push against, and then the secondary one would be that you'd want to check the tongue, okay, to make sure. Why? Because you know what? Think about, okay, how people eat. The food enters in and the person will chew up and down. And then what happens? Lateral. They go side to side. So lateral means the tongue has to lateralize. Why? Because if the tongue lateralizes, it's going to stop things from getting caught down in your cheek.
You'll pocket.
And then you'll pocket. And then once you go from lateral, you then go to rotary. Okay, so if I'm missing lateral, guess what? Okay, it doesn't matter if you do rotary. What's going to happen is pieces of food are going to get passed or pocket, and the bolus is not going to form properly. And then when they go to swallow, okay, the food's going to get caught in the different passageways, the particulates. And that's because we know, right, if one side isn't working, okay, we can get food caught and then the individual could possibly aspirate. So a lot to this one, hypoglossal, because there's a lot that goes on with the tongue. Some things to remember, right?
Yep.
Okay, well, this concludes the cranial nerve in terms of the assessments. It's not perfect. We're not doing every single one, but I think we've captured a great deal of information. So we're hoping that this helps, and we're hoping that it makes sense. So thanks again, and look forward to seeing you on the next OT Help Desk.